Hello and welcome to Pandemic Podcast for Educators. My name's Gawain.
I'm Karam.
And I'm Merike.
If you're new to the podcast, please do subscribe using the button below so you don't miss an episode. Today we're going to be talking about the new schools COVID map, which has been produced by the NEU, and we're really pleased to be joined by Andrew Bales, who's the architect of this new site. We'll be hearing more about what that does in just a moment, but first of all, to set the context, we are still facing rising COVID rates, especially in the northeast and northwest. They seem to be continuing with no end. Karam, you've been listening into Independent Sage today, haven't you? Can you tell us a bit more about this?
Yeah, so they started off the meeting today with there is no good news. Test and trace effectiveness is falling, and there are major concerns about the outbreaks in the north. They reckon that we've got just under a week until we reach the same level of infections as we had on March the 23rd when we went into lockdown. They made several key suggestions, including calling for large-scale investment, basically mimicking the National Education Union's Plan B. They've called for masks, and they've called for social distancing in schools as well, which does lead into the Public Health England advice that was updated last week. Public Health England have now decided that aerosol transmission is one of the main causes of infection. Lots of advice for various workplaces has been updated. However, the Department for Education has not bothered to update it. So therefore, there is major concerns going on now that we are not as safe as any other workplace.
So this is basically things are continuing to get worse because of government mishandling of the crisis, and bit by bit, everything that the union has said is being proved true. We need that investment, we need a plan B, and we urgently need to get testing sorted and masks in schools. So they're not updated the schools guidance at all?
No, there's nothing. It still even says from when it was first published in the summer holidays, it still has a line at the start saying cases are falling around the country, and they haven't even removed that line.
Wow. And yet the rates in the northeast and northwest, I mean, this is now a significant proportion of the population, isn't it?
It's starting to become worrying. I think Andrew may have some stats on it.
Yeah, the ONS pilot survey, which is a random sample of the population, was released this morning and makes very sobering reading. They have a regional breakdown of the rate of COVID infection. And for the northeast, the northwest and Yorkshire Humber, the rates are 1.25% of the population, 1% and 1.25% of the population. So those are staggeringly high numbers, because if you turn that into how many per 100,000, you're talking about more than 1,000 per 100,000 for each of them. And when you think that previously we've been told we couldn't go on holiday to bits of the world because the rate was above 20 per 100,000, you realize just how staggeringly high those numbers are. And the other bit of that, which was also very worrying, was the rate of infection amongst secondary age people. So it's actually marked on the ONS survey. So year 7 to year 11, that age group has double the rate of the general population. So if you're thinking about, where you can then think about having rates of 2.5% of the population. So imagine a secondary school with 1,000 pupils and 100 staff. That means you're going to have more than 20 people walking around in the school with an infection. And of course, because of the rate of because of the high rates of children who are asymptomatic, you wouldn't know. You really wouldn't know.
Yeah, so we're talking. I mean, that's equivalent to a rate of 2,500 per
Yeah.
100,000, isn't it? In the secondary school population. So I mean, this surely undermines all of those arguments the government was making at the beginning about children don't transmit. It may well apply with younger children that rates are lower, but when we're looking at secondary age students, actually the rates are far higher. So we need urgent action in our schools. Merike, you're teaching in the Northeast. I mean, this must be really worrying for you and your colleagues. I know you're primary, but still, colleagues in the secondary sector?
Yeah, colleagues in the secondary sector are definitely worried about it. I mean, we're worried about it in primary. Whilst they're saying that there's no real evidence that there's the same level of spread from primary age students. And I've said this before, the pupils I work with literally cough and spit in my face because they're 3.
Yeah.
You know, it's not that they're doing it to be mean. They're 3. They just do it when they need to. There are cases in primary schools of symptomatic children. There are cases in primary schools of asymptomatic children who've been tested positive because a family member was tested positive, so the family member then got their family tested. One of our local secondary schools has just announced their 3rd confirmed positive case within 2 days. They've already got masks in communal areas, so trying to figure out other things that they can do. It's not a good picture at all, and people are being put at risk, and it's not good enough.
Yeah, so we need urgent action, and the government's response so far is completely inadequate. So as part of this, the NEU, and this is what we're talking about today, the NEU has launched this site, the Schools COVID Map, which is a tool to enable people to respond to this changing situation. Is it? Andrew, can you tell us a bit about the map and how it works, what it does?
Well, it's a map of the country. It's got a little marker for every school in the country, including even independent schools, and actually FE colleges are in there, but all the other state schools are on as well. And then it gives you just some basic information about the rate of COVID around the school. So obviously it isn't about, because unfortunately that information is very tightly held. We don't know what the rates are in school, but we do obviously know what they are around the school because the government's quite good at publishing that information. So the first thing it'll tell you is the school in an area on a government watch list? So, you know, these areas of concern, enhanced support and intervention. Actually, it looks like we're gonna have to change that because the watch list wasn't published today, as it would have been on every other week for the last couple of months. And I think that's because they're changing the system because it's become, you know, too confusing and the Prime Minister can never remember what it means. So I
gives you a lot of faith, doesn't it, in the leadership when they can't remember what the actual...
So we've got a traffic light system because I think Boris can manage 3 colours. And then so anyway, it tells you that, and then it tells you the rate in the district. So if that's, you know, that would be a district council area or a metropolitan borough area. So it gives you that rate for the previous week. And it'll tell you whether it's going up or down, which is obviously very important because if it is quite high, but at least you can see it's coming down, then you've got some reassurance that the measures that are being taken locally are working. Of course, conversely, if you see you've got a high number and it's going up, there's less reassurance because you know that people haven't got a handle on it, to be honest with you.
The stricter measures are needed at that point,
Yeah, and then the other thing it will tell you is, so it's like the locality and the neighbouring locality. So I live in a bit of Hackney called Hackney Downs, it's not a ward, it's like a ward. It's an area from the census called a mid super output area, MSOA. So I've taken that and then I've added them up, not just for the one the school's in, but for all its neighbours. And the idea is that a school's catchment area will very likely fall within
Right.
That plus its neighbours. And I think the useful thing about it is it's a bit more localised than the district rate. But also, if a school is on a boundary, then it will be picking up the rates from neighbouring areas.
Of course,
because,
across that boundary, which might be
kids
around the
come
corner
across
from the school.
boundaries.
Yeah.
Yeah,
Okay.
absolutely. So it's the intention is to be more relevant than just the district rate. So to give people a better idea of what the general rate of infection is. So that's the information you get. And then there's an ask. So we ask you then to email your MP calling for the things the NU's been calling for all along. Much more rapid testing for teachers and pupils. Starting up, getting towards asymptomatic testing so that we get a better idea, because we know so many kids are asymptomatic. And then investment money so that we reduce class sizes, so that we do sensible measures to make schools safe, not just for the people in the school, but for the community that they serve as well. So that, yeah, and then there's a bit of public health guidance as well, because the striking thing is I've been struck when I've been working on this, is the extent to which people aren't particularly clear about what the local COVID rate is to them.
Yeah.
And B, they sort of got some idea, but not really, and it can often be quite out of date. And then also aren't always as clear as they should be. And I think the government's quite to blame for this, about what the public health measures are. Because it's just the message, I think, is so confusing. The way all the I'm not sure, haziness about advice around schools hasn't helped, because we haven't got a clear set of guidance from the PHE, and they're losing out.
It's not just schools, is it? I mean, we've had, since the beginning of this crisis, we've had complete confusion around, what size groups are allowed to gather where. I mean, you see the memes, don't you, on social media saying, you can have tea with a chimpanzee on a Friday, but not a Saturday in the 3rd week of July. Or, I mean, the guidance has been muddled, to say the least, hasn't it? So,
the fact we've got Amanda Spielman, head of Ofsted, saying that aerosol transmission is a myth, when it's an established scientific fact now. I mean, the level of incompetence and poor advice from the DfE is astonishing, really.
So essentially, we're filling that gap. We're putting that advice out there because the government doesn't seem capable of doing it. So we'll come on to the asks a little bit in a minute. But first of all, tell us a little bit about the data, because this sounds really, really useful. But what people need to know is it accurate? Because we know the government, what they're putting out is muddled, it's not easy to understand, and we know that in the past, when we've done things like this, tried to supply the public with information, they've accused us of scaremongering, of playing with the figures. So can you reassure us, is the data accurate? If people use this tool, if they log on there, how accurate is it?
Yeah, so what we've done is it's updated every Friday, because that's when the government the Public Health England release their COVID report every Friday. Right. And we're mirroring their timetable. Now, the purpose of that is, the reason for that is local public health teams work off the same set of numbers that we're working off. Right. I know that some people have said, oh, well, can't you update it daily, because, it's changing daily, and you can go on some of the government sites, or, some people do update it daily. The problem with that is, I think, is that you can't really make these decisions on a day-to-day basis. Yeah. So if you're talking to a public health official, it is kind of a conversation that's going to be over a little bit of time. So, and then I wanted to make sure that we had got exactly the same numbers that they will have.
So essentially, this is the same information that's being used by public health officials. It's just we're making it accessible to the public, so they can check their local school, to educators, so they can check the local school or college and see what the rates are, what the guidance is, etc. Are we able to try out a school then? Are we able to have a look at some data?
Yeah.
Karam, you're in West Berkshire, aren't you? I'm not going to get you to choose your school, but Andrew, could you give us a random school in West Berkshire? Maybe go for a random primary school in West Berkshire and let us know a bit about it.
Let's see what we've got here. So I have got Fir Tree Primary School and Nursery, which is, where the heck is that?
West Berkshire.
It's somewhere in West Berkshire, in Newbury.
Okay, in Newbury.
Okay, so we've got Fir Tree Primary and Nursery School in Newbury, West Berkshire. Well, first of all, West Berkshire isn't on a government watch list, so that's good news. The district rate is 39 per 100,000, and that has come up quite a bit because only a few weeks ago it was down at less than 10. And then for the locality, remember I was talking about that rate, that's 51 per 100,000. So these are quite, what was a few weeks ago had very, very low rates. It's now a really quite a high rate, nothing like other bits of the country, I should hasten to add.
I was going to say that's a lot lower than you just told my school.
But it's starting to rise.
Dead pleased if her school comes up anywhere like that, but yeah.
So Karam, go on. That's an area. It's not your local area, but it's near to you. How do you feel on looking at those figures? What does it suggest to you? What might your response be to that?
They are very similar figures to the ones in my little area by my school as well. They are low, and I'm still grateful that I'm not living by Merike at the moment with their infection rates.
I won't take that personally. It's all right.
But the concern is the fact is it is still rising, and it is rising at a fairly considerable rate at the moment. That is a concern. Also, I was at our district meeting yesterday, and we've got 17 confirmed cases across our schools in West Berkshire at the moment.
So in response to that data and the information you've just shared there, that's an area where, although it's nowhere near as high as other bits of the country, you might be looking now, what additional measures can be taken in schools? How can we start to stop the spread before you rise to those kind of rates? Yeah, it's a kind of area you might be working with the local council, with public health officials, etc., to take additional measures.
Yeah, so we've taken proactive measurements in our school. So we've done what is happening in intervention areas under the tier 1, and we've introduced mask wearing across the whole school, apart from in classrooms, for all staff and pupils. Having taken the lead in my school, we are now using that as a district to go to the other schools in the area to encourage them to say, look, this school down the road is doing it. It's made the parents happier. It's made staff happier. And we're pushing that now. And there is a lot of talk going on in the background to see about getting those other schools following that as well. And we're hoping that by taking these measures before we get into trouble, like some other parts of the country, but hopefully we'll head off some of the risk of infection within the school.
Right. So it's a great model, isn't it? The website provides some information, but then it leads to you doing something locally in response to that, and actually spreading that, organising it, spreading it across your schools and taking action. But Merike, more severe actions needed in the northeast, right?
Yeah, absolutely. So as a response to that, mainly from colleagues up in Tyneside and Wearside, with the local authorities, 7 local authorities which are under the tighter restrictions. However, the campaign that they've come up with, which is called Campaign for Safer Schools, applies to all of our region, because case rates have risen exponentially. And in Stockton, we've now got higher rate than in Durham, and they're under a thing, and we're on a watch list with enhanced support, whatever that actually means.
Whatever it means. But tell us a bit about this campaign then. So the Campaign for Safer Schools, what's it? So
Campaign for Safer Schools, we've got 4 asks. So we've got asking for an immediate increase in the availability of testing for staff and pupils, because many of them are stuck at home, they're waiting for tests, etc. We want asymptomatic testing of staff and older pupils, because we've already acknowledged that a lot of children are asymptomatic and therefore are spreading it around without even knowing it. We want Nightingale classrooms to safeguard social distancing, so taking over public buildings to allow expanded space for classrooms and smaller bubbles and social distancing, because we know that bigger class sizes lead to bigger transmission network. We want protection for at-risk educators, so at-risk staff should be supported to work from home, particularly in areas where there's high cases, and we want a guarantee that school health and safety costs will be reimbursed, because it's a phenomenal cause. I think we've mentioned this before. There's a school that I know of in Northumberland that was quoted as having already, by the end of September, having spent over £1,000 on face coverings and PPE type costs.
I mean, the
on
costs
that,
for schools are
with our
huge, aren't
they? So in discussion with our local authority the other week, this week actually, at Schools Forum, and we were saying about the cost of PPE and face coverings for students who've forgotten them but they need to wear them in communal areas, blah, 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 blah. We expressed disdain at the fact that there's no longer that grant that we can apply for to reimburse the costs, because it was there in the summer. The problem's got worse, it's not got better, so why have they taken the funding away? Ridiculous. Get that sorted, please, DfE. But there was a point that was raised, which was the masks that students and staff are wearing in communal areas are classed as face coverings, not PPE, because of the type of mask that they are. Therefore, they can be seen as exempt from any form of grant like that anywhere. So that needs to be sorted, because that's ridiculous. You're expecting people to be wearing them, they need to be provided and they need to be paid for, not coming out of already overstretched budgets. And it's just going to end up leading to staffing reductions due to redundancy situations at a time where we actually need more staff to have smaller class sizes.
Yeah, so massively important demands there, particularly on the funding.
We have a petition.
Yeah, go on. I was going to say, what can we do to build around these demands? Because it's absolutely crucial, isn't it? They actually need to be taken now.
So we have a petition. If you have a look at, if you've got social media, have a look at North East Campaign for Safer Schools. 4 is in the number 4, and there is a link on there to an Action Network petition. If you sign that, it sends it to Prime Minister, actually. Get involved in the campaign, tick on the side, send your details over. The people running it will be in touch, no doubt, to see what you can do on a more local level. We had a really good, actually, launch Zoom meeting this week. We had Sarah Kilpatrick from Gateshead, who's an art teacher. She spoke passionately about the impact it's having on her school, her staff, colleagues and the students. We had Emma Heenan, who's a parent in County Durham, was again speaking really passionate about the impact it's having on parents and home learning and lockdown situations, etc. We had Emens, who's the MP for Gateshead, and importantly is on the Education Select Committee.
Yeah.
So we've already got someone in government who is supporting us, who is quite key really to getting our points and aims across. And we had Kevin Courtney, Joint General Secretary of the National Education Union, speaking as well, all of whom are fully supportive of the aims of this campaign. If you're not in the North East, have a chat to the people in your local area. I know I say this every week, get in touch with your local branch and district.
Yeah, and get campaigns built and get going.
Get the campaign built. Message the Facebook page that we've already got up and running. If you are wanting that campaign to be up and running in your area, I'm sure the people that are running that page would be more than happy to help and get this off the ground. Everybody needs to be hammering on at the government to get these demands met.
And this is one of the things that the site allows us to do, isn't it, Andrew? You can, as well as you were mentioning earlier, so it gives the information so that you're aware of the situation in your local area, but also of the trends, whether it's rising or falling. It gives the public health information so that you know how you might want to respond to that. And so you can organise around that locally in your schools. But it also allows you to put pressure on government. Am I right? How does that work?
Yeah, so there's just a little simple click button thing where you can, you put in your postcode and then it will find your MP for you, and it will give you some draft text that you can then amend to give your message, calling on your MP to support our demands to make schools safer. So we've had 2,000 people do that so far, so that's quite good. We could do with an awful lot more because we've had 500,000 visitors to the site. So you would,
Right.
it'd be nice to have a higher conversion rate on
Definitely.
that.
So when you're on that site, click that button. Don't just check out the rate, but get in there and put the pressure on, because nothing's going to change if we don't pressure them, is it?
Well, it isn't. And I think what's really striking now is that all of Sage pretty much seem to be coming out on a daily basis to say, we have to change policy, we have to change policy. And the government is just dragging their heels and are just trying to do, it would seem to me, take as long as possible to do as little as possible. So it really isn't about public health, I think. It's a political problem.
Yeah.
I think the public health world are very clear about what the issues are. It's that the politicians aren't following their advice. And the worry is, of course, we know from March that when they didn't follow the public health advice, an awful lot of people ended up dying and hospitalized as a consequence. And it's horrible to think that mistake could be repeated again.
Definitely a really sobering thought, and essentially that the message is simple. Once again, our government needs a little encouragement from us to do the right thing, so people have to get on there and get encouraging. Final question, because we're close to the end of today's podcast, Andrew, but I hope this isn't a controversial one. Who's the site available to? Who can check out their school at the moment?
Well, at the moment, it's all English schools, but we're ready to go with an update that will then include all Welsh and all Northern Irish schools as well.
Oh,
so
fantastic. So we are...
any day now, we will include them as well, because we've got the date done, the data's all done. Just need to get sign off and then it'll be there.
That's fantastic, because massively important. We want all of our members to be able to access this resource. And of course, the public, the parents, whether they're in schools or colleges, we want people to be able to access this resource right across. So that's fantastic news to hear that it's now to be expanded to Wales and Northern Ireland as well. Fantastic. And I mean, you know, what a practical and useful resource, not just to enable us to know what's going on, but to be able to take action and have that impact to make our schools, our colleges, our communities safer, because ultimately that's what we need, isn't it? So final takeaways from each of you. And Andrew, any final message you'd like to put out to our listeners?
Final messages. I think really it is to hammer the government about this. We have to get them. It's really urgent. We need a change in school policy and we need a change in general policy on COVID.
Excellent. So press the government for that change. Merike, any final words?
Check out the campaign for safer schools, sign the petition, hammer government, as Andrew says, hammer your local MP, councillors, everybody needs to be coming at this from the same position.
Fantastic. And Karam, any final message?
A couple of quick points just to reiterate why this is so important. There was a report released today saying the cost of COVID safety measures has now gone up to 400 million schools have spent already, which is almost the same size as the catch-up fund, which was just over 600 million. So we are in desperate
money
need
goes
of this
in, money goes out. Yeah.
And nearly 20% of schools are partially shut due to large-scale isolations. So they've got a choice. We either provide these Nightingale schools, put in these resources and do it orderly so that children's educations aren't damaged, or we end up with a disorderly collapse due to lack of testing and isolation.
Right. So the message is clear, I think, from the whole of this session, isn't it? Now is the time to pile the pressure on government. Our schools can't wait for it. Our communities need to be made safe. So get on that website, check out the campaign for safer schools. But make sure if you're there on the school's COVID map, you're checking out the rates, you're checking the guidance, but make sure you click that button, put the pressure on our MPs, make our government do the right thing. Thank you very much, Merike, Karam, Andrew, thanks for joining us today. And thanks to all our listeners. Please do make sure you subscribe so you don't miss an episode, and you will hear us again next week. Thanks very much for joining us. Bye-bye.
Bye.
Bye-bye.